Welcome back, everyone. I would like to introduce Cristin Kearns and Jayla Burton, who will speak about breast cancer and the documents.
Thank you, Naf. So I am going to talk with you today in conjunction with Jayla Burton. We're co-presenting here today our project Industry Influence over Scientific Information on Breast Cancer, exploring the UCSF Industry Documents Library. Just quickly, a little bit about my background. So I'm an assistant professor in the UCSF School of Dentistry and our Philip R. Lee Institute for Health Policy Studies. And my work has really been focused on the sugar industry, and I've been connected to the Food Industry Documents Archive, which I helped with the launch of that archive back in 2018. So I'm going to start off with some key facts about breast cancer. So breast cancer is one of the most common forms of cancer in women. In the US, over 42,000 women and 500 men die of breast cancer each year. And family history accounts for only 10% of breast cancer diagnoses. And we know that a large and growing body of evidence indicates that toxic chemicals may increase the risk of developing breast cancer, as well as other environmental exposures such as diet, smoking, and drugs. So this project really got its start back in January 2021 when the California Breast Cancer Research Program launched a request for proposals to explore the UCSF Industry Documents Library related to breast cancer. So they noticed, looking through the bibliography of publications that had come out of the Industry Documents Library, they searched those for the word breast, and they only found a single newspaper article. So none of the scientific publications coming out of the Industry Documents Library had looked at the issue of breast cancer. And so the California Breast Cancer Research Program wanted a team to explore those documents. Is there something worth exploring further in those documents? And they were particularly interested in any internal research sponsored by the tobacco, chemical, pharmaceutical, food, and fossil fuel industries related to environmental exposures in breast cancer, and public relations campaigns sponsored by these industries designed to influence public opinion about environmental exposures in breast cancer. And so when we got started on this project, just doing a very preliminary search for the term breast cancer showed us that there were over 55,000 documents across the Industry Documents Library related to breast cancer. Of course, the most being in the tobacco collections, since it is the largest. So to do the work of this exploratory project over the time frame of a year, and with actually quite a limited budget, we were able to pull together this amazing transdisciplinary team to work in conjunction to scope the various archives. And we brought together a team that has expertise in public health, community engagement and advocacy, communications, medical anthropology, political science, environmental health, breast cancer epidemiology, sociology, food, tobacco, and chemical industry studies, and library sciences. So you can see we had breast cancer action and key partners from UCSF, including the Center for Tobacco Control, the Earth Center, the Cancer Center, the library, and then a partner at University of Nevada, Reno. And just very quickly on our overall approach. So this one-year project, in the blue circle, we split this into quarters. So we spent the first quarter just doing high-level scoping and an initial assessment of the documents related to breast cancer. We identified key topics for in-depth review in the second quarter. We outlined our findings in the third quarter and then started to work and plan for disseminating results in the fourth quarter. And we used some methodologies, including community-based participatory research, of course, traditional industry documents methods, but we also tried out some new things, including social worlds analysis and situational analysis, drawing on sociology. So we started with trying to get a sense for what were some of the key threatening events to the various industries related to breast cancer that are contained in the documents. And so we found over 50 key threatening events spanning from the years 1969 to 2015. And on the left is an example of a 1969 report from the US Department of Health, Education, and Welfare Commission on Pesticides and their relationship to environmental health, which mentions breast cancer, all the way up to the 2015 Environmental Protection Agency Cancer Assessment Review Committee's review of glyphosate toxicity. So these were all reports and events that the industries were paying attention to that had some connection between environmental exposures and breast cancer. So after our initial scoping, our team worked together to identify topics for further review. We couldn't explore them all in the time that we had. So we selected smoking, environmental tobacco smoke, hormonal replacement therapy, glyphosate, benzene, DDT, recombinant bovine somatotropin, and dietary fat. And then to give you a sense for some of the key actors that we were exploring, so of course, Philip Morris, R.J. Reynolds, but also pharmaceutical companies, Wyeth Ayerst, Monsanto, documents related to Shell, ExxonMobil, trade associations like the American Petroleum Institute and the American Chemistry Council, and then industry front groups such as the American Council on Science and Health and the International Life Sciences Institute. And just to show you a couple of examples of documents. So this first one is related to Monsanto and their product, recombinant bovine somatotropin product that was used to increase milk production in cows, and RBST residues being found in milk had been linked to breast cancer. So this document is an interaction between Monsanto and Dr. Frederick Stare, who is the chair of Harvard's Department of Nutrition. So the date across the top is March 15th, 1995. This was actually a fax coming in from Monsanto to Dr. Stare. Stare had received a phone call from Lisa Watson, who was manager of the Health and Consumer Affairs at Monsanto. And Monsanto in the 90s here needed help to counter a bill that was being introduced by Representative Piner in Massachusetts state legislature the next day. So Monsanto provided Dr. Stare with a model letter that they considered, quote, very strong and positive. You can see in the handwritten note there. This model letter would support Monsanto's position that RBST was safe. And that model letter had been written the day before by Ronald Kleinman, an MD, a prestigious pediatrician at Mass General Hospital. And his letter included this quote, also, I'm aware of the attempts by some misinformed individuals here in Massachusetts to link the use of BST to human health concerns, especially breast cancer. So Monsanto was able to reach out and get two very powerful and legitimate medical professionals to support their case. And then we can see a follow-up communication, March 25th, 1995, where Fred Stare is receiving a thank you note from Monsanto. They're saying, thank you for the letter opposing the BST bills in Massachusetts. Your letter was very effective with legislators. Several of the committee members referenced it during the hearing. So essentially, Fred Stare at Harvard and Kleinman at Mass General were acting as PR consultants for Monsanto in the 1990s related to this issue. So for the next series of slides, I'm going to share some very high-level findings from the different archives with you, just to give you a sense for what they contain. There's much, much more to explore here, and we really only scratch the surface. So starting with some of the tobacco industry findings related to the Council for Tobacco Research and the Tobacco Institute. This project was performed by Eileen Hahn. She's actually here with us today. She identified at least 13,000 documents indicating that the tobacco industry's organizations had sponsored research projects relating to breast cancer between the 1970s to the 1990s, resulting in at least 38 industry-sponsored publications. And Eileen organized them into 2 time periods and kind of categorized them related to 2 separate issues. So we know that the industry monitored external research supporting claims that smoking is not causally linked to breast cancer. And the CTR funded projects supporting non-tobacco related explanations for breast cancer risks, including genetics and estrogen metabolism. They also capitalized on external aromatase inhibitors research, which was or is a hormonal treatment for breast cancer. And the industry funded projects to demonstrate smoking's positive effects on breast cancer due to the aromatase inhibitor content of smoke, and projects on aromatase inhibitor extraction for therapeutic purposes. They also highlighted epidemiological studies of breast cancer mortality to shift attention away from lung cancer. And then in the 1990s, the industry's public relations strategy shift to methodological critiques of these studies, particularly epidemiological studies. With the discovery of breast cancer genes in the 1990s, the industry documents indicate a rise in industry-funded research on genetic causes of breast cancer. They also continue to conduct research on hormonal therapy, and new projects on potential breast cancer therapies were initiated, such as being related to vitamin D and protein protease therapeutics. A second look at tobacco industry findings led by Eric Crosby and his team, they identified at least 1,000 documents related to Philip Morris and R.J. Reynolds' responses to events leading up to the 1997 and 2005 California Environmental Protection Agency report on environmental tobacco smoke. So looking at the 1997 report, Eric characterized their key strategy as being deflection and misdirection. So it included publishing research, attending scientific conferences, highlighting important studies that had attempted to deflect attention away from the relationship between environmental tobacco smoke and cancer and towards other potential causes of breast cancer, including alcohol use, body mass index, premenopausal and postmenopausal status, reproductive effects, and others. And then related to the 2005 report, given the emerging evidence surrounding smoking and cancer leading up to this report, the tobacco company's main efforts shifted to a strategy of denial and suppression of the evidence. So this included using similar tactics, criticizing important studies that found a relationship between environmental tobacco smoke and breast cancer. And they continued to argue that there were other potential causes of breast cancer, such as alcohol use, and they scrutinized the validity of emerging studies, research design, sample size, and other methodological shortcomings. And then shifting to the archives related to fossil fuel, the drug industries, and the chemical industries, this part of the project was led by Shada Abui, working with Tracy Woodruff in the Earth Center. So Shada was able to identify at least 350 documents related to the oil industry and breast cancer. So she found that Shell Oil and others hired a company called the Environ Corporation to undermine the generalizability of animal models to humans related to benzene exposure and mammary or ovarian tumors. She found documents suggesting that these oil companies shifted blame from benzene to dietary fat related to breast cancer, and some evidence of Exxon's contributions to the Susan G. Komen Foundation local chapter in Houston. She also found at least 175 documents related to the pharmaceutical company Wyeth Ayers. She found evidence that Wyeth had developed a public relations campaign in response to evidence that Premarin increases breast cancer risk. And then she also found at least 250 documents related to Monsanto and their hiring of a firm called Sustainalytics, which they hired to mitigate the impact of a 2015 International Agency for Research on Cancer report, which had many negative things in it, but also related to breast cancer as well. And then shifting to the Food Industry Documents Archive, and this was my portion of the project, I found that related to dietary fat, there's at least 10,000 documents related to this issue. And actually that spreads across the entire industry documents collection. And what we find is that it wasn't just the food industry that was concerned about this issue of dietary fat, it was also the chemical industries, fossil fuel, and tobacco industry. And they were all interested and involved in influencing dietary recommendations. And they had an interest in shifting the blame for breast cancer to dietary fat. In the 1990s, related to DDT, there's at least 100 documents showing that the American Council on Science and Health and the International Life Sciences Institute secretly engaged leaders at the Mount Sinai Medical School and Harvard to criticize evidence linking DDT residues in foods to breast cancer. And the last example is related to the documents that I showed you earlier, where Monsanto recruited experts at Mass General and Harvard to counter that state legislation related to RBST. And there's at least 143 documents related to this incident in the library. So some quick conclusions and recommendations from this portion of the presentation. I think our project demonstrated that the Industry Documents Library is a rich source of data related to environmental exposures in breast cancer. We think that there are many more breast cancer topics to explore. There are many documents on alcohol that we didn't have a chance to really scope. Research funding obviously is critical to continue this work. This has a lot of relevance to understanding contemporary public-private partnerships and potential conflicts of interest in working with various companies. And it reinforces the need to really refocus public health attention on environmental root causes of breast cancer. And with that, I'm going to turn it over to Jayla.
Thank you, Cristin. And hello, everyone. My name is Jayla Burton, and I am currently working as program support with Breast Cancer Action, the advocacy partner on this project. And I get the honor of working with current staff at the organization, Halima, who is currently on this call, and Zoe Christopher, to continue the work that we started a little bit over a year ago. So with that being said, I will give a little bit of an overview of Breast Cancer Action as an organization. I think that our organization is completely and extremely aligned with this project, as our mission is to achieve health justice for those people living with and at risk of breast cancer by focusing on systemic interventions. We do that in three ways. One, we focus on issues of treatment, screening, and diagnosis. So making sure that people who are living with breast cancer and their loved ones have unbiased information to make informed decisions about their care. Two, focusing on the root causes of breast cancer. So having a commitment to reducing involuntary exposures to toxic chemicals in our environment that may be linked to breast cancer. And three, pink ribbon marketing and culture, which a quick way to sum that up is holding the cancer industry accountable. Next slide. And so what do we mean by holding the cancer industry accountable, and who exactly is the cancer industry? So we've defined the cancer industry as corporations, organizations, or agencies, and even industries that diminish or mask the extent of the cancer problem in general by failing to protect our health or diverting attention away from the importance of finding the root causes of the disease. So this includes many of the industries that were explored during this project, from companies that, in addition to profiting from cancer treatment drugs, sometimes produce toxic chemicals that also may be contributing to higher rates across the country, to polluting industries that also continue to release substances in our environments that are suspected to be a danger to public health in general, and more specifically breast cancer. Next slide, please. And so to talk a little bit more about like what Breast Cancer Action as an organization does about these bad actors that we've identified as industry leaders. Well, in 2002, the organization launched a corporate accountability campaign called Think Before You Pink, in response to the growing concern of the number of pink ribbons that were on the market. That campaign really called for a lot of transparency and accountability for these industries, and also encouraged consumers to think more critically about pink ribbon promotions more generally. And so this campaign usually takes place in the month of October every year, but I would say that it is the bedrock of just a larger campaign to hold industries accountable and call them out for their hypocrisy, in which we coined the term pink washer, which we see as an organization or company that claims to have an interest or care about breast cancer, but at the same time is doing something that is opposing the best interest of the folks that are most affected. Next slide. And so the way that Breast Cancer Action is able to continue to be a watchdog for the breast cancer movement is through its conflict of interest policy, which is something that Cristin mentioned before in the conclusions after, reporting out on what were some of the findings, is how this can be helpful for advocacy organizations or people that are, doing the work, but don't want to, like succumb to the industry in any type of way. And so Breast Cancer Action has a strict conflict of interest policy, and in that the organization doesn't accept any money or donations from corporations whose entity or business includes breast cancer screening or treatment, and also industries that sell or manufacture products or services that are known to be suspected harms for the community. So some of the examples of what industries or organizations that could be are listed on the slide. So the resource like the Industry Document Library can be very useful for our organization to avoid conflict of interest in partnerships, and that can be true for organizations that are doing similar work as well. Next slide, please. So as a community partner on this project, we worked with the research team as they were exploring the documents to inform some of the questions and keywords that were being searched throughout the documents library. And once we had adequate evidence of what some of the industry tactics were, we hosted 3 separate focus groups with community organizations working at the intersect of breast cancer to share those initial findings and to get feedback on their reactions to further inform dissemination of this info that we found. So we divided the focus groups into 3 main subject areas. One was about tobacco industry documents collection specifically. We did another group that was specifically for the chemical groups that were explored. So that's the DDT, glyphosate, and benzene, and then a third focus group to focus on food and pharma companies. And so that focused on the RBST and dietary fat. And if you could go to the next slide. Some of the key takeaways from the group that we kind of received were, one, the Industry Documents Library seemed to be very useful in understanding a broad scope of the high-level industry tactics over several generations and how industry has responded and shifted those tactics over time. Another takeaway was that the focus group participants identified that there were a lot of similarities and differences across the industries and how they were responding. And so that was a really meaty part of the conversation there. In addition to that, the IDL was also identified as a helpful resources for developing policy initiatives and holding federal organizations accountable. And lastly, actually not lastly, but they also express a want to further educate the scientific community on how to defend scientific practices from commercial threats. So this could be useful for advocacy organizations who are also receiving money or donations from industry leaders as well, so that they are not at the feet of those commercial threats either. And then lastly, it's useful information to incorporate within trainings and educational resources so that advocates have what they need when they are asking for the things that they want. So those are some of the main takeaways that we found when we hosted our focus groups. And if you can go to the next slide, I think overall, as an advocacy organization, we look forward to sharing more about how the IDL can be used to advance advocacy efforts in the field of breast cancer, and welcome you all to join our special session that we will be hosting on breast cancer during this workshop. And we will most likely convene a group of interested individuals beyond this workshop to discuss more ways the IDL can be used to advance the work that's already being done. So if you have any questions, you can reach out to Cristin, Halima, or myself, and hopefully we can engage with y'all a little bit more as we kind of work through and have a hands-on opportunity to look through the documents that might interest the different works that we're all doing together. So that is all. Thank you.
Thanks, Jayla. Sorry about that blank last slide there. But I do think we have a few minutes for any Q&A if there happens to be anything out there.
Yes. Question to Cristin. Were there payments, direct or indirect, for writing those 2 letters by Mass General and nutrition doctors and faculty? And was there some coordination scheme with the Massachusetts legislature who then used those letters in their argument?
Great, yeah, thank you for that question. I believe there's definitely evidence of indirect payments from Monsanto to Harvard, to the nutrition department at Harvard. And so there are follow-up communications where you can see Monsanto giving a donation after this incident occurred. And Monsanto is actually a regular contributor to the Department of Nutrition at Harvard, I think going all the way back to maybe the 1930s. So I think you could even find copies of checks really demonstrating this relationship. I haven't seen it so much for the Mass General physician, but that doesn't mean there's not something in there. And the coordination scheme with the Massachusetts legislator, that's a good question, who then used those letters in their arguments. I actually don't know that. That would be a great thing to follow up on and sort of triangulate out there in the world to see how specifically these documents were used in that discussion about the RBST legislation. You can also see follow-up documents in addition to that thank you going back and forth from various people at Monsanto, kind of explaining the success of this relationship.
Thank you, Cristin. And there's a question for Jayla, and I'm not quite sure I understand the wording. Why not accept donations from health insurance organizations? Can you please explain the dynamics?
Yeah, and I kind of understand that question, so happy to chime in. But mainly the reason is that Breast Cancer Action as an organization wants to be an unbiased party. And so unfortunately, if we were to accept money from health insurance companies, that would really limit the availability or the opportunity for us to be critical of them. If there was ever anything that we did think that needs to be critiqued and improved on. Also, there has been lots of work over the last couple of years. I don't think there's anything in the last year or so that the organization has worked on, but where we have had to be critical of certain bills that have a lot to do with healthcare coverage specifically. And so remaining neutral, not neutral per se, but we think it's very important to remain in a position where we have the ability to not be bought or silenced because of the money that we are receiving from different entities. So that is why. Hopefully that answers the question.
Thank you, Jayla. And there's no more questions.
Oh, thank you, Jayla, and thank you, Cristin. And now we'll hear from Andre da Silva, who will talk to us about the documents and how they relate to tobacco control in Brazil.
Hello, everyone. Thank you, Naftali. So, my name is André Silva. I'm from Brazil. I work for the regulatory agents, to help regulatory agents in Brazil, Anvisa. And I'm here to show how the tobacco industry documents were important to the tobacco control in Brazil, and in some manner show how the tobacco industry documents could be used to support the tobacco control policies outside USA. So Brazil is the 5th largest country in the world with 213 million people. And Brazil, it's one of the global leaders in tobacco control. And one of the countries that achievements in tobacco control are really, really impressive. And the Brazilian Health Regulatory Agency is responsible for health surveillance and sanitary control of products, services, and manufacture. And the tobacco control in Brazil, it's recognized by WHO and other instances in the world as one of the global leaders. And the numbers show the results of the tobacco control policies in Brazil. And this graphic shows how the green one, it's the Brazilian tobacco use prevalence, smoking hates in Brazil, and the blue USA, and red Americas, and yellow it's in the world. And in 1996, the first Brazilian regulation to smoke-free bans and ban the advertising was implemented. In 1999, the Anvisa was created, the Health Regulatory Agency. It's the first regulatory agency in the world, health regulatory agency in the world mandated to control tobacco. And at the same year, Brazil implemented the need to register the tobacco products under the auspices of the Health Regulatory Agency. In 2001, Brazil was the second country in the world to implement the health warnings, the pictorial health warnings in the tobacco products package. And Brazil was the first country in the world to ban the use of misleading terms, light, mild, and low tar, low nicotine are not allowed since in 2001. In 2002, Brazil banned the food that imitates tobacco, like chocolate, cigarettes, and candies that imitate tobacco. In 2005, Brazil ratified the Framework Convention for Tobacco Control. In 2009, Brazil banned the electronic devices to smoke. And in Brazil, we classify a little bit different from the US. So to the Brazilian regulation, electronic devices to smoke includes the electronic cigarettes and heating the tobacco products and hybrid products too. And in 2011, Brazil banned the use of additives in tobacco products. And I use this case to show how you could use the tobacco industry documents to support and regulations. In 2013, the Brazil banned the toys and the products directed to the youngs that imitate tobacco. In 2018, Brazil banned the exposition of tobacco close to the candies and sweets and other food targets to the kids. So how we use the tobacco industry documents in Brazil to support the regulations? First one, it's to anticipate and expose tobacco industry strategies. For example, marketing to special groups like kids and women. Create and update regulatory practice. The additive bans, the picture health warnings are good examples that regulations, that part of regulations were based on the findings on tobacco industry documents. And the third, and maybe the most important, is to respond the industry allegations in courts and regulatory process against any tobacco control regulation. So as I mentioned, I used in tobacco additive regulation. We had an additive ban regulatory process, the 2010 to 2013 in Brazil, and the Brazil faced in a stronger position from tobacco industry. And the tobacco industry supported the conceptualization and development of regulation and countered the industry arguments in courts and during regulatory process. So I selected just to show how is our regulation in Brazil. It's a little bit different from the US and maybe other countries, because the tobacco additive in Brazil is different from other countries that not allow characterizing flavors in tobacco products. And in Brazil, the additive bans include any additives that are able to change any sensorial characteristic of the smoke or the emission of the product. And so, for example, an additive used to reduce harshness are not allowed. Even this additive not impart any characterizing flavor or any specific flavor. And additionally, additives with nutritional properties like vitamins and minerals are not allowed. Stimulating properties are not allowed to. Pigments, fruit and vegetable products, seasonings, herbs, spices, ameliorants, ammonia, and sweeteners are not allowed to. And it's one of the most restrictive tobacco additive ban in the world. And we reached this final form of regulation based on the tobacco industry documents, because the documents, there are plenty of information about how the tobacco companies use additives to improve the taste of smoke, to attract new users. So of course, the opposition of tobacco companies are really huge and impressive. And basically, they use lobby, and some congressmen are directly involved to delay the process or try to stop the process. Sorry, because the newspaper is in the Portuguese, but basically lobby delays ban on additives and mentions some congressmen involved to delay the process. Misleading science, the tobacco companies hired some institutions to produce reports, and the reports conclude the additive bans, it's not useful, that's no impact on public health, and it's unnecessary measure because the people are not attracted by additives. Basically, it was the conclusion of this document. And the tobacco companies try to manipulate the public opinion through the ads in several newspapers in Brazil. And these ads mention the increase of the illicit trade, and the stores will be closed, and tobacco growers will face a dangerous future because the restriction of additives will affect the tobacco production. And as I mentioned, they try to delay regulatory process, but not only using lobby. The tobacco companies produce forms, pre-filled forms, and people fill the forms and send to Anvisa and send more than 100,000 letters. I'm not talking about emails or messages, it's old school letters. So we had to open any letters, read all letters, and scan all letters to include in the regulatory process. And of course, litigation. And to understand the situation, we published a paper about this specific case. And if you are curious, but now I show how some arguments used by tobacco industry and during this process. And then today in courts, you use the documents to answer these allegations. The first argument, of course, I select few arguments. It's not we don't have time to use all arguments used by tobacco companies, but I chose some very interesting, because one of the tobacco industry arguments that's only cigarettes with characteristic flavors are attractive. As I mentioned, our regulation, it's beyond the characterizing flavor. And menthol and clove cigarettes are exceptions. So the tobacco companies allege that only cigarettes with characteristic flavors are attractive, but menthol and clove cigarettes are not attractive. So when you research on the tobacco industry documents, we found, of course, plenty of documents. I select just a few examples. And so this document is very interesting because many US blend products carry subliminal quantities of menthol on their top dressing flavor. This should not have a perceptible cooling effect or mint taste to the majority of smokers. It is added at this level as an irritant reducer and to add cleaner aftertaste. So the argument that the additives are not below the characterizing flavor threshold are not changed the flavor of the product are not truth. And this about the menthol cigarettes and clove cigarettes, actually we don't need to research directly in the documents, because the scientific literature has a plenty of papers published using the tobacco industry documents about how the menthol cigarettes are used to facilitate the smoke initiation, and how the menthol are used to attract new smokers. And the other arguments used by tobacco companies that it's impossible to make American blend cigarettes without additives. And American blend, because basically in the world, we have two types of cigarettes. One type is the American blend, that's a mixture of the different types of tobacco, Virginia tobacco, Burley tobacco, and Oriental tobacco. Of course, they use the stems and reconstituted tobacco, but let's just to facilitate the explanation. And the American blend cigarettes, it's a mixture of three types. Basically, it's a mixture of three types of different tobacco types. And the tobacco companies allege that it's impossible to make American blend cigarettes without additives. And especially the Burley tobacco, one type of the tobacco used in the American blend cigarettes, needs sugar in case in process to be processed. It's not possible to use Burley tobacco without sugars. So when you look these arguments and you made research on the tobacco industry documents, first we found a document that's the majority of these ingredients, such as cocoa and sugars, are used to enhance aroma and flavor, because the allegation this is sugar, it's needed for the processing, but the sugar are not impart or change the flavor of smoke of the product. And other are used to enhance the sensory aspects, include taste associated with the smoke, such as menthol. So, and this document, it's about the blend that's with no additives. And we found too, and the patent That's the patent. It's about how to make the casing process. It's a part of the one step of the process of tobacco to make the American blend cigarette. And this is a patent. And this patent is about how to make American blend cigarettes and make the burley casing without sugars. So since 1996, the tobacco companies know how to make American blend cigarettes without additives and without sugars. Another argument, because they are very important additives in cigarette manufacturing, especially when we are talking about the flavor, is additives like cocoa, licorice are not used to change or improve the tobacco taste. So the argument is these additives are used just to replace the flavors lost during the curing. Curing is a part of the tobacco processing. It's basically a drying. You take the leaf and remove the all water. But when you look to the tobacco industry documents about the effects of cocoa and licorice and cigarettes, the documents are very clear about the cocoa. What does it do? Adds deep, heavy cocoa flavor notes and smooths the smoke. And licorice imparts deep, heavy wood flavor notes and imparts slightly sweetness. So the argument that both additives are not impart or change any aspect of the flavor, it's not true. And current status of regulation, we have an injunction, and that allows major companies to keep selling the products with additives. That is the bad part. But the good part, that's no longer discussion that the additives make the tobacco products more attractive, because this injunction, it's about if Anvisa has the mandate or not to regulate tobacco. But the technical aspects, all courts no longer accept. And the argument that additives not make the product more attractive, or the discussion about the levels of additives. So that's the good part. And the arguments to change this understanding of the courts basically come from the tobacco industry documents. And that's a huge opportunity to us in Anvisa to learn how the cigarettes were made and how the tobacco companies use the additives. So industry documents are a powerful tool to support the effective regulations. Lessons learned from Brazil could be used in other countries, because we are not US. So because some colleagues from other countries sometimes, oh, I'm afraid because the documents are very, very USA focused, but not. Unfortunately, the tobacco companies are very, very democratic and universal to use their strategies, and I strongly stimulate people that no English speakers make some research on the tobacco industry documents, because we are able to find documents in a, so could be interesting. If you found some document language. And the tobacco industry strategies are needed for, especially for developed countries. And if you want to learn about new and not so new technologies, tobacco industry documents are very, very interesting research, despite the documents are old or not so new. But in this, you find the beginning of the development of technology like the flavor capsules, synthetic nicotine, and even the electronic devices to smoke. We are able to find something in the tobacco industry documents. And some of documents are very, very, very educational, because now I know how the flavor capsules work, because the documents are very, very didactic. So that could be another way to use the tobacco industry documents, is to learn about the technologies used today. So thank you so much for everyone. Please, if you have questions, concerns, feel free. I see a question. Fascinating illustration of how dogs were hardened by the defense and tobacco industry sponsored cases against the governmental policy. 2 questions. The founder of Anvisa and the time frame of tobacco control policy was very interesting. Were enlightened individuals involved in this founding? And what is institutional hierarchy and coordination structure between Brazilian Minister of Health and Anvisa? I will invert the answer method to facilitate the answer. Anvisa is a health regulatory agency. He's linked to the Minister of Health, but it's not subordinated to the Minister of Health. It's an independent regulatory agency. It's similar, of course, it's hard to compare the structure, but it's similar in some degree with FDA. That's, of course, FDA has the relation with the Minister of Health, but that's not, FDA is independent. It's like an Anvisa. And about the founding, let me see if you understand your question, Mildred. If the individuals involved in its founding, we are talking about the start of the Anvisa, the work of the start of the work on Visa, or you start about the founding of the financing of the Anvisa? Oh, actually, this there are at time in 1999, the former Minister of Health it was very involved in the tobacco control, and at the same time, the Brazil faced a huge problem with the quality of the medicines, and the Brazilian government at the time decided to open a health regulatory agency to control medicines and food. But the former Minister of Health, as I mentioned, it was the tobacco control, and he gave the idea to include the tobacco control under the auspices of health regulatory agents. So that is the history of the why the tobacco control was included in Anvisa. And nowadays, for example, FDA has the same structure with the tobacco control sector and inside the FDA. But in our case, we're the first one in the world to use this approach. And I think this was a very good approach. Another question is from Paulo Correa. It's a very good friend from Brazil. It's, what do you think could be done to end the court injection and rule out the additives in Brazil for good? Paulo, I think nowadays it's much more a political question, or needs a political pressure. And I have to highlight the importance of in my experience, the importance of the medical doctors in Brazil to tobacco control, because all the beginning of tobacco control in Brazil was started by medical doctors, different from other countries. That some countries, at least, you have the civil society and some organizations, or even ministers of health. In Brazil, the tobacco control started with the medical doctors, and the political power that medical doctors have in Brazil. And now it's a much more, and I think it's a political pressure especially from medical doctor associations and labor unions of medical doctors and other health professionals, and other associations like the Brazilian Association of the Álcool and other drugs. And I I think today it's just a matter of the political pressure, because the process it's in the very end. It's just someone to judge the process, and until this point we win all steps. So I think it's the participation of civil society, the medical doctors, as the old school advocacy in Brazil will be the answer to finish this injunction. So any other questions, comments? So no more questions. And Naftali, is up to you. And thank you so much for all attendees, and thank you so much for invitation for Center for Tobacco Control Research and Education.